Dr. Wilson Kwong is a UBC graduate who practices his dental profession in Vancouver. When he's not drilling and filling, he educates other professionals about oral health, hygiene, and cosmetic dentistry. He's a member of the American Academy of Cosmetic Dentistry and of the BC Institute for Oral Implantology. It is my pleasure to welcome Dr. Wilson Kwong to Studio 4 to tell us more.
Thanks for having me.
Nice to meet you. Dentistry called you? Or your mother or father said, I think you should be a dentist's son?
Dentistry called me. I was 16 years old, being an immigrant kid, and that was the first time going to the dentist because of a root canal. And that was the worst experience I've ever had, having the pain. It was the best experience I ever had getting out of pain. So that day was the day.
Well, I've never had a root canal, but I hear they hurt a bit, especially the day after. Do they have to with modern dentistry?
No, it's easily done now. There's very little pain, a little bit of discomfort, but the benefits outweigh the pain for sure.
Sure.
Yeah.
When a dentist looks in our mouth today, in our mouths, what is he or she looking for?
Well, we're looking for cavities.
Yeah.
We're looking for gum disease. We're looking for other things like oral cancer. We're looking for signs of systemic disease like diabetes or heart disease, because if we have a bad mouth, sometimes it relates to the heart as well.
Really? So what's going on in your mouth could affect, not necessarily affect, but what's going on in your body could be revealed in your mouth.
That's correct. That's correct. Every time. I have patients sometimes, they don't even know they're sick. And when we look in their mouth, we kind of go, what's going on in here? There's a big change from last time. Sometimes we realize that they're taking medication. Sometimes they have diabetes that they don't know. And so we send them out for tests, and sometimes we find out that there is something going on.
Sure. Yeah. Inflammation. Inflammation is the cause of many diseases, as you know, or certainly many diseases are inflammatory. What about our gums, keeping healthy gums? I know we're supposed to floss.
You are
I got that message.
You flossed this morning, you told me.
I did, because I knew you were coming. I even flossed in the back.
Well, inflammation is a bad thing. It sets up a whole series of stressful events for our body. We don't even know we're under strain, but our body knows that. So keeping healthy gums is really paramount as part of our overall health. A
bacteria causes decay. I learned that in university in biology or microbiology. Still the case?
Absolutely. It's the germs that causes the problems.
So if it's the germs that causes the problems, do you believe in a mouthwash, in a natural mouthwash? I know that there's green dentistry popping up all over.
Yeah. I'm still a believer in fluoride.
You are?
Yes, absolutely. We don't have fluoride in Vancouver.
No, not in the water.
Not in the water. People think we have it, but we don't. So we need to have fluoride because it keeps the teeth strong, and it also keeps the bacterial load down.
Sure.
And part of that is brushing, flossing, of course.
Right, and as you know, still terribly controversial, and we'll have the fluoride discussion another day, because I grew up on fluoridated water. I'm still here.
That's right.
That's good. The new ways to not have dentures when we age, many new ways to not have false teeth.
That's right.
Like my grandpa, who of course never wore them.
Well, my dad had dentures, and he never really enjoyed his food. He lived with it because people get used to having dentures, because it's not the other way around.
No,
you get used to your dentures.
In a perfect world, Dr. Kwong, as you know, we'd like not to have to go there. So what are the options?
Well, number one is prevention.
Right.
And if that doesn't work, going to the dentist, make sure everything's well taken care of, much like you would with your car. You need to make sure you change the oil in your car. Well, just like your car, you need to make sure your mouth is well maintained. If you have lost teeth, then it's really easy now to place a few implants in. And the implants costs have come down quite a bit. We put the implants in, we recreate what nature had taken away.
And how do you put an implant in? Briefly.
It's very simple. We place an implant that's about 10 millimeters long into the jawbone, let everything heal, and then we place teeth on top of that.
Okay, but is the patient knocked out? Yes.
Sometimes.
Tell me that's true.
Sometimes,
no.
and you can. And you can do that, because you can have sedation, you can have a pill, and it'll knock you out for a little while. Or if you're really, really nervous, you can have sedation dentistry, where they put an IV in you.
Okay.
And after that, you're out, and they can do the work without you even feeling anything.
So in the days when they said, Mr. Jones, we're going to have to take all your teeth out, They usually did that all at once, right?
Yeah, usually.
All at once. Now, today, if you have an implants, would you go under sedation and have all your teeth implanted if you were a candidate for dentures?
If you are a candidate for denture, if you're healthy enough, you can get sedation done. A lot of my patients choose not to. They just have a little pill just to calm them down. It's kind of like having 3 glasses of wine.
Right.
Like
well,
for me, it's 1 glass, but
one glass, but for me, it
people.
might be 3.
Yeah.
However, I know when I go to the dentist, I had to have a wisdom tooth pulled when I was older, because I was terrified to have it done when I was younger.
That's right.
When the dentist suggested I have it done, no, I waited till it
So
blew.
you didn't listen to your dentist?
No. I waited till it blew up, and
Right.
then my friends brought me flowers, and I had to have a Valium. It was embarrassing.
Right.
And it actually didn't hurt.
No.
It was easier than having a filling.
Well, extractions, if it's done well, I call it the Tai Chi of dentistry. Some dentists, they pull really hard, really fast. That's Kung Fu dentistry.
Right.
Tai Chi dentistry is actually very slow, and you almost work and allow the body to give it up. So
There is kind of a twist, I have to say.
A little bit.
A little bit of a twist, but then the tooth is gone and all's well. And the new type of antibacterial things they put in your mouth, there was a time when you had teeth pulled and you had big wads of cotton or something. And now they seem to have nice little things that just plunk in there.
we do a lot of nice things now in dentistry. It's changed. It's not like the old ways where you go in there and you're like scared, you know what. And now there's TVs in the ceiling, there's pillows, there's blankets, there's music. There's everything to calm you down so that your experience can be the best that it can be. And that's changing in dentistry.
Well, my dentist not only sings opera, he plays opera. So there. So it's good. If you like opera, he's a good dentist to go to. And, you know, and he appreciates that I'm a gripper and don't breathe and that I might sit up during the procedure. He's kind of used to me. But that happens. So all these smiles. Tell me about too white, not white enough, the options for cosmetic dentistry today.
Well, we want to, when we redo smiles or give people a smile design, we want that smile to fit that person's face, the lips, the personality, skin tone. All those things come into play.
Right.
We don't just slap, you know, white teeth on people.
No.
We actually design that from a functional standpoint, because most teeth are broken down or they look the way they do because there's a functional issue going on.
Right.
Okay, so we make it to fit that person.
And can you do that with just whitening in some cases? Do you believe in whitening?
I do. We've been using whitening for almost 20 years now.
Okay.
And nobody's died from that as well.
That's good to know.
But that's
I'm always suspect of all of it. I think, I don't know.
Yeah. Sometimes with people that have certain, if they have a lot of restorations in their mouth, or they just have teeth that are all over the place, sometimes we use other disciplines like orthodontics to move the teeth first so that we don't have to prepare the teeth so much.
Okay. And how do you use laser today?
Well, we use lasers
in dentistry.
We use lasers for hard tissue and soft tissue. Sometimes people need a little bit of gum, like a little eyebrow tuck, or we do that with a laser.
And if your gums are receding, I know that's not a good thing, but if gums recede, is that a genetic thing? Is it because you haven't taken care of your teeth? Because you're aging? What?
Everything. Most of the time, people have recession. It's actually bone loss. The bone has actually crept away, and then the gums follow. So you end up with this long tooth. That's why they call it long in the tooth.
Right.
But usually there's a functional issue involved. People are grinding their teeth. They're either stressed out or their teeth don't fit, so they're grinding away. Well, when you put too much pressure on something, well, the bone's going to give.
Sure. Right. And how important is bite? How do you check bite? If we have a proper bite or a bite like a beaver bite?
Everything is bite. In dentistry, everything is the bite. And we start from there, analyzing, is it a good bite? Is it a bad bite? Do we fix it? How do we do that? How do we get to the good bite?
Okay.
So everything is about the bite.
And why is it so important?
Well, it's important because the teeth have to fit, and the muscles have to guide that bite into that place.
And do you think if somebody has a crooked tooth or a gap in a tooth or whatever, no matter what the age, braces are the answer? Is there another way to make your teeth straighter?
Well, one of the things we talk about is, do we really need to work on that crooked tooth? Can we live with it? And a lot of times, the crooked tooth can cause problems with cleanability. If you have a tooth that's overlapped, then it's going to be harder to keep clean. So we want to make sure that the person can keep that tooth clean for the rest of their life, so they can avoid cavities and problems with the gums.
Well, and as I said to you earlier, when you're a little bit older, your grandchildren tell you, you've forgotten you had the crooked tooth. And then your grandson says, Baba, you have a really crooked tooth. And I say, I know. He said, really crooked. You go, okay, grow up, become a dentist.
Yeah.
Maybe one day.
It's easy to do now. There's braces, there's traditional braces, there's clear braces. There's lots of different technologies available.
Yes, dentistry is one of the fields that has really come to the fore, come along.
Yeah, we've done a good job.
Way easier now, I must say.
Yeah.
Thank you.
Thank you very much.
Nice to meet you. Dr. Wilson Kwong, he has a practice in Oak Ridge, and he is a BC Institute for Oral Implantology member, as well as you've been to the Las Vegas Institute too?
Yes, I have.
For advanced dental studies. Thank you.
Thank you.
Dr. Wilson Kwong.